my name is Periman. I'm in the Seattle, Washington area, and I've been in practice since 2002. I use PROKERA for a variety of indications. The vast majority of the time, it's an advanced keratitis situation in my advanced dry eye disease practice. So we find excellent success with using the PROKERA device to help rescue patients from that inflammatory abyss that they find themselves in, and we can start to reverse the disease state to where they can get some real healing. So with PROKERA, I only have experience with PROKERA, with the cryopreserved. I don't have experience with the dried material. And the reason for that is I find the Pentraxin 3 story to be very compelling from a molecular biology point of view. And that's my personal background and personal interest. So I find it to be a compelling story, and I find that technology to perform extremely well for me in clinic. I have had several wow moments, but the one that really sticks out in my mind is when I first started using the device. I had a 54-year-old patient present to clinic with a chemical injury to her eye. Now, she had been born with congenital ptosis. She had had several frontalis sling repairs, ptosis revision surgeries, and so that eye had significant more dryness than her right eye, which also had dry eye disease. She was working, making a costume, and accidentally put Fray Check into her eye instead of Celluvisc. Of course, this created a chemical injury to the ocular surface. The entire conjunctiva was denuded, deepithelialized, the cornea were exposed to the chemical, complete epithelial debridement. So I thought, well, this is a compromised surface at the get-go. I need to be aggressive in my wound healing management strategy. So I offered her a PROKERA ring. And when that ring came out 5 days later, I was absolutely astounded that the areas where the amniotic membrane was in contact with the areas of severe chemical injury had healed beautifully. The small areas in the fornix where the skirt of the amniotic membrane did not reach still was deepithelialized and still had significant inflammation. So to me, that was my wow moment.